So here the list of the disease and list of the medication, what essential for the patient. If the patient have a respiratory problem like asthma or COPD, the pathology of the disease, COPD or asthma, bronchitis, all causes bronchoconstriction. So you have to have something that causes bronchodilation. So if my patient have a respiratory problem, definitely we have to give, or it would be treated by bronchodilator. So what are the bronchodilator we use frequently? Like albuterol or theophylline or salbutamol. So salbutamol or albuterol, both are bronchodilator. Especially in the acute condition, we use albuterol or salbutamol. Theophylline, also bronchodilator. So all of the medications specially used for respiratory problem like salmeterol, oh my God, salbutamol or salmeterol or albuterol, theophylline, all of the medication can cause trachypnea, increase palpitation. So this is the common side effect, right? So a drugs, it is called anticholinergics. So anticholinergics, basically we use, this medication commonly used like atropine or rubinol. So anticholinergics, basically atropine, commonly used, right? Anticholinergics are the drugs that blocks the action of acetylcholine. Acetylcholine is a neurotransmitter or a chemical messenger. It transfers the signal between certain cells to affected how your body function. So anticholinergic can treat a variety of conditions, including urinary incontinence, one of the use, right? Urinary incontinence or overactive bladder, or we can use for COPD, means chronic obstructive pulmonary disorder. Even atropine, we use certain type of poisoning, right? So not only the atropine, also other drugs, but most commonly we use atropine. Other common drugs are called belladonna or benzotropine or cyclopentolate, diclomine, right? So all of the anticholinergic, ipratropium bromide, most popular member is anticholinergic, ipratropium bromide or oxybutyrine. Okay, so this is the most common medication we use as a anticholinergics, right? So I said this is we use for overactive bladder, or we use for urinary incontinence, overactive bladder, COPD, or sometimes we use atropine for poisonous cases, or we use for before the surgical operation in with the anesthesia. What else? Another medication we use, this is called cholinergics. This is anticholinergics, right? And this one is called cholinergics. Okay, so anticholinergics, but now we are going to talk cholinergics, right? So cholinergics especially we use for neostigmine, right? Neostigmine, most common one. So cholinergic agents or drugs are compound which mimic the action of cholinergen, yeah, acetylcholine, right? So choline, the word is called choline. So if I say what are the cholinergic drugs used for, these drugs we use for myasthenia gravis, is rotated myasthenia gravis, right? Cholinergic like neostigmine. So cholinergic drugs stimulate the parasympathetic nervous system by copying the action of acetylcholine. And cholinergic drugs are given for Alzheimer's disease or glaucoma or paralytic alias, urinary retention, and myasthenia gravis. So if NCLEX board asks which medication we use for myasthenia gravis, cholinergic drugs. What are the name of cholinergic drugs? Neostigmine, right? Neostigmine. So, and also the cholinergic medication are available in the various formulation. For example, like pilocarpine or physiostigmine or neostigmine. This is the drugs we use. When we use as a mitotic agents, the administration is via ophthalmic eye drops. For treatment of myasthenia gravis, or it is called pyridostigmine by orally we use. What next? The next medication here are called antipsychotics or antipsychotics. So antipsychotics may be the medication we use for psychiatric problem, right? It's called antipsychotic medication, basically. So like clozapine, thorazine, haloperidol, risperidol, olazapine, quentapine, so all are antipsychotic medication, right? Let me recap it. As I told you, the antipsychotic or antipsychotic medication can reduce or release the symptom of psychosis, such as delusion or hallucination. Delusion means false belief. Hallucination means false belief with perception. Anticholinergics, right? So anticholinergics medication can reduce or release the symptom of psychosis, as I told before. What are the psychosis? Means delusion, hallucination, right? So antipsychotics, formerly known as a major tranquilizer, and neuroleptics. Antipsychotic medication are the main class of drugs used to treat the people with a psychiatric disorder or schizophrenia. They are also used to treat the people with a psychosis, right? Psychosis. So psychosis that occur in bipolar or depression or Alzheimer's disease. So other use of antipsychotic including the stabilizing the mood in bipolar, like mood stabilizer lithium is a antipsychotic. They reduce the anxiety in anxiety disorder and reduce the tics in some symptom. Antipsychotic, we are here. Antipsychotic medication can help to claim and clear the confusion in a person with acute psychosis, right? Psychosis within hour to days after use, but they can take up 4 to 6 weeks to reach their full effect. So antipsychotics, sometimes NCLEX board asks, how long take time antipsychotic start to work? So usually they take up to 4 to 6 weeks to reach their full effect. And this medication can help to control the symptom, but they do not cure underlying condition, right? When taken over a long time, antipsychotic can help to prevent further episode of psychosis. My friend, what is psychosis? Psychosis are the like delusion, hallucination. What is hallucination? What is delusion? It is a false belief. When false belief with perception, it is hallucination, right? So sometimes the antipsychotic we use with other antipsychotic. So combining antipsychotic medication with other therapy and support can help to the people to manage the symptom and improve the quality of life. Okay. Basically, the combined therapy or family therapy, peer symptom, or school or job counseling. So the patient need the counseling also or any other psychotherapy beside the antipsychotic medication. Okay. So when we give this medication to the patient, we have to educate them about the side effect of this medication. Most of the antipsychotic medication have a common side effect. I'm going to talk what are the common side effect. Like easy way to remember, especially I did, it is A, B, C, D, right? Up to. A for alter the vital sign. So the person who take antipsychotic, their vital sign will be altered. Like patient develop hypotension, blood pressure reduce, right? They develop B stand for blur of vision. C stand for the patient who take antipsychotic for a long time, they develop constipation, they develop confusion. A, B, C, and then D for distension of urine or retention of urine, dizziness, right? So all are the common side effect of antipsychotic. So antipsychotic taking the care of physical health is especially important if you take antipsychotic medication, both like schizophrenia or schizophrenia, and the medication used to treat it can increase the risks of develop diabetic or other serious health problem. So the patient who take the antipsychotic, they need regular checkup, right? Regular checkup. So getting regular checkup and medical care can help you to have a good physical health, eating nutritious diet, or exercise regularly and getting enough sleep can also help you to get and stay well. Okay, so let me go the next one. So aspirin here. So keep in mind that aspirin is a non-steroidal anti-inflammatory drugs. But aspirin we also use as a blood thinner. So aspirin we use for pain medication, we use as a blood thinner, or we can use for fever, right? So, and let me recap it. So aspirin is a non-steroidal anti-inflammatory drugs and blood thinner. It can treat the pain, fever, headache, and inflammation. It can also reduce the risks of heart attack. Usually the aspirin are enteric coated tablet, or it's called enteric coated aspirin, right? Sometimes aspirin we use as a aspirin children, it is called, okay? But basically it is good if you take aspirin after doctor counseling. So aspirin is, when you give the aspirin, aspirin has some side effect like tinnitus, GI bleeding, right? So if patient has a gastritis or stomach problem, it is good not to take aspirin, or it is good take aspirin with food, right? Aspirin is an everyday painkiller, basically. We can buy it over the counter. So aspirin, I said, is a painkiller for any kind of aching or pain, such as headache, even toothache, even menstrual period pain. It can also be used to treat the cold and flu-like symptom. The aspirin, also known as a acetyl salicylic acid, other name is called acetylic salicylic acid, right? So another medication is called NSAID, right? Especially ibuprofen, like indomethacin. So basically, what are the common drugs we use or buy for the pain is called Tylenol. Everybody know that, Tylenol. So aspirin or Tylenol belongs to the different drug classes. Aspirin is a non-steroidal anti-inflammatory or NSAID, and Tylenol is an analgesic, means pain reliever, or antipyretics, means fever reducer. But keep in mind, it is good if we do not give aspirin to the children, because sometimes aspirin causes the toxicity in the children. So aspirin is often co-administered during the treatment of infection even. Salicylic acid, the active metabolite of aspirin. And this salicylic acid has a significant effect on bacteria that might improve or compromise the effect of antibiotics, right? So now little bit talk about the NSAID. Okay, so if I ask what are the example of NSAID we use, okay, so example is called indomethacin or acetaminophen, ibuprofen, naproxen, right, or diclofenac. All are commonly used as a non-steroidal anti-inflammatory drugs, right? They reduce the pain, they reduce the fever, and also prevent the blood clot. And in higher dose, decrease the inflammation. The side effect depends on specific drugs, but largely include and increase the risk of gastrointestinal ulcer or bleeding, right? So if overdose, they causes the kidney disease or kidney problem, right? So again, I said, what are the drug list or name we use as a NSAID? Like ibuprofen, naproxen, diclofenac, celecoxib, wrote it here, CELECOXIB. It is called Celebrex or celecoxib, right? Indomethacin, most commonly used. Highdose aspirin, I said, or low dose aspirin is not normally considered to be as a NSAID, but high dose aspirin is considered as a NSAID. Okay, so now go for all diuretics. Here, remember the Lasix or tobramycin, right? So Lasix or furosemide, torsemide, acetazolamide, all are diuretics, right? So diuretics basically we use for high blood pressure, right? So all diuretics we use for high blood pressure or any other medical condition like reduce the edema. So diuretics is also called water pill, and commonly treated for high blood pressure, commonly. So find out how they work. We have to know how they work and when you might need them. So basically diuretics work on renal tubules, right? And diuretics causes increase the frequency or amount of the urine, and sometimes diuretics is called water pill, I said, and also help the rid your body of salt or water, right? And most of them help your kidney release from sodium into the urine. So there are several types of diuretics, but there are three types that are most common, like loop diuretics or potassium sparing diuretics, also thiazide diuretics. Okay. Out of all, the loop diuretics are most potent diuretics. Most potent diuretics as they increase the elimination of sodium and chloride by primarily preventing reabsorption of sodium and chloride, right? So before to go the next drugs, I want to recap the drug list we use as a diuretics, like bumetanide or chlorothiazide or chlorothiazide or chlorhydrochlorothiazide, furosemide, right? So all are common diuretics. And diuretics are the faster or safest to reduce the high blood pressure. Okay. Now go the here. This is the medication called prozac. Prozac. So prozac basically are the psychiatric drugs. Prozac, I said. So prozac basically I said psychiatric drugs, and prozac has some side effect basically. So side effect are they cause sleep problem, means insomnia, or they cause the headache, dizziness, drowsiness, vision change, or tremor. Tremor means shaking. Patient develop anxiety or pain, weakness, GI upset or stomach upset, loss of appetite, nausea, vomiting, and diarrhea. So the Prozac, other name is called fluoxetine. The other name of Prozac are fluoxetine. The Prozac or fluoxetine are selective serotonin reuptake inhibitor, shortly called SSRI. So this prozac we use as an antidepressant. Prozac or fluoxetine affect the certain chemical neurotransmitter that communicate between the brain and helps the people with depression, panic disorder, anxiety disorder, or obsessive compulsive disorder. Basically, Prozac are used in the treatment of major depressive disorder or obsessive compulsive disorder, or we use for eating disorder like bulimia nervosa, or even the Prozac or fluoxetine we use for premenstrual dysphoric disorder or panic disorder. And Prozac is sometimes used together with another medication which is called olanzapine. So Prozac and olanzapine together we use to treat manic depression. Manic depression caused by bipolar disorder. And this combination is also used to treat depression after at least 2 other medications have been tried without successful treatment of symptom. So I said that sometime NCLEX board asks the side effect of this group of medication. I want to recap it. This medication cause dry mouth or GI upset like nausea, vomiting, or headache, diarrhea, nervousness, restlessness, and agitation and anxiety. If your patient is so young or reproductive age group, it is not to prescribe because Prozac or fluoxetine causes sexual dysfunction. So what next? Next group of medication is here the gout. Gout. We the medication is called allopurinol or colchicine. So allopurinol or colchicine we use for gout, right? So also it is here, they said what they wrote, the colchicine has some side effect, okay? Like they cause skin rash or diarrhea, nausea, or change in the liver function. So hepatotoxic allopurinol or colchicine. So as I told you, this is the colchicine are the drugs of choice for gout. Okay. So first of all, allopurinol is used to decrease the uric acid level in the blood. And urine of people with a high uric acid. So the person who have a high uric acid level or gout who use allopurinol. Sometimes kidney stone, kidney damage, or treatment with dialysis, we use the allopurinol. Even we use sometimes cancer chemotherapy or psoriasis. But what we have to know, or what are the most frequently asking question for the gout, what are the medication we use? It is called allopurinol. Or allopurinol we use for what? For gout. What are the common side effects of allopurinol? Skin rash, diarrhea, nausea, or change the liver function, right? Another medication we use for gout, that one is called colchicine, right? Colchicine, I said. His name is here, colchicine for the gout. So colchicine is a they have a nature of anti-inflammation. It can treat and prevent gout attack. It can also treat some familial Mediterranean fever as well, right? So colchicine is a medicine for treating inflammation, I said, and pain. It can use to treat the gout, also prevent the flare up of gout when you first start on a medication like allopurinol. Okay, so what are the common side effects of colchicine? Like allopurinol, they cause GI upset like diarrhea, nausea, vomiting. Sometimes they cause constipation or abdominal ache or abdominal pain, right? So what we have to know, basic information about the gout, very basic. So or sometimes it's called gouty arthritis. So this is gout at a form of arthritis characterized by severe pain, redness, or tenderness in the joint. So pain and inflammation occur when too much uric acid crystal and deposit in joint, right? So gout is caused by a condition known as the hyperuremia, where there is a too much uric acid in the body, and body makes the uric acid when it breaks down the purine, or which are found in our body, or we can find it in food. Sometime I said, and Clex board asks what kind of food basically patient has to avoid if patient have the gout, because some of the food and drinks often trigger the gout attack. So the food, especially the organ meat or any kind of meat or some type of fish, fruit juice, or alcohol usually attack, or we have to avoid if patient have the gout. What next? Next is here, is called Ativan. So Ativan basically we use to prevent the seizure, right? So Ativan, we have said, we use for the seizure. Seizure is involuntary movement of muscle, right? Involuntary movement. So your muscle is not under your control. Anything can possible to happen if your muscle is not controlled. Ativan is a fast acting benzodiazepam. Everybody know what is benzodiazepam. Benzodiazepam are the anti-anxiolytic medication. What a treat for anxiety. So Ativan also used for anxiety, not only the seizure, right? So what are the most common side effects of Ativan or benzodiazepam? They can cause drowsiness or dizziness, sometimes muscle weakness, headache, blur of vision, or they causes sleep problem or insomnia, loss of balance or coordination. So if you have to prescribe this medication, it is good to tell your patient, do not take this type of medication before driving the car, right? Before driving the car or dealing with heavy machineries. So what is, you have to keep a note. Ativan is a benzodiazepam, and benzodiazepam we use for anxiety. Benzodiazepam are the class of psychoactive drugs. Used for anxiety, used for seizure or spasm. The groups of drugs we call benzodiazepam are alprazolam, diazepam, lorazepam, barbiturate, clonazepam, all are the benzodiazepam group of medication. Let me recap it. Alprazolam or clonazepam or clorazepate, diazepam, flurazepam, lorazepam. So ending of all are pam, lorazepam, flurazepam, diazepam, clonazepam, alprazolam. So all, right, it's benzodiazepam, I said. So sometime NCLEX board asks, what are the use of benzodiazepam? You are very smart, you can say anxiety, right? Anxiety. So if I said, what are the common side effect? What are the common side effect of benzodiazepam? Okay. Common side effect of benzodiazepam, they can causes the dizziness, confusion, tremor, all of this, right? What next? Next are here called tamoxifen. It's called tamoxifen. So tamoxifen we use as a anti-neoplastic drugs or anti-cancer drugs. Tamoxifen, it is anti-cancer or neoplastic. So this tamoxifen, it can treat the breast cancer. It can also prevent the breast cancer in the women at the high risks of developing it, right? So tamoxifen attaches to the hormone receptor in the cancer cell and blocking estrogen from attaching to the receptor. So what are the common side effects of tamoxifen? The most common side effect of tamoxifen are increase the tumor or bone pain. They cause hot flashes or nausea, fatigue, mood switching, depression, headache, or hair thinning. Another medication here is called Kdur. Okay, it's called Kdur. So sometimes some books said this is a Kdur 20. So common Kdur, it is the medication in a mineral supplement used to treat or prevent low amount of potassium. So if anybody has a hypokalemia or less potassium, you have to give Kdur. So a normal level of potassium in the blood is very important, right? Because hypokalemia or hyperkalemia both lead to arrhythmias. If arrhythmia is not treated, they lead to heart failure and patient die, right? So potassium helps your cell, your kidney, your heart, muscle, and nerve cell. So what are the common side effects of Kdur? They causes the GI upset like nausea, vomiting, diarrhea, or gas formation, stomach pain. Basically, Kdur have a tablet form most of the time because IV or injectable calcium is dangerous. Always we have to dilute it and then we have to give to the patient, but orally is better, safe route. If you ask me what are the generic name of Kdur or Kdur, the generic name is called potassium chloride extended release tablet, right? Okay, so next medication here is called Cardizem. Okay, so this medication basically we use for heart problem is called Cardizem. So again I said this medication, Cardizem, we use to prevent the chest pain, or we use this medication for any other, heart-related problem. The common side effect of cardizem, they causes the light headache, weakness, nausea, flushing, constipation. If any of this effect persist or worsen, always we have to contact with a healthcare provider. Okay, so sometimes this medication relaxing the blood vessels and reduce the blood group, blood pressure. The other name of this is called Deltasm. Deltasm. So maybe now it is very common, you already read or know, right? So cardizem or diltiazem hydrochloride, it is the calcium channel blocker. So calcium channel blocker we use to prevent chest pain like angina, or we use to reduce the high blood pressure. Sometimes diltiazem or cardizem may help to increase your ability to exercise and decrease how often you may get angina attack. But don't forget that the diltiazem has some of the side effects like dizziness, light headache, weakness, nausea, GI upset, and most common flushing, right? And sometimes they cause sore throat, dry cough, or stuffy nose. So what next? Next is here heparin, right? Heparin are, everybody know that heparin are the blood thinner, right? So heparin, another medication we use warfarin or coumadin. Heparin is the blood thinner, or coumadin or levodopa or the name. Heparin or warfarin is an anticoagulant or blood thinner. Heparin basically we use in emergency cases as an injectable form, but warfarin we use orally as a maintenance dose. Heparin is an anticoagulant or blood thinner that prevent to the formation of blood clot, and heparin is used to treat and prevent blood clot caused by certain medical condition or medical procedure. It is also used before surgery to reduce the risks of blood clot, right? So if I said what are the indication or use of heparin, heparin is used to prevent the blood clot from forming in the people who have certain medical condition. So what are the most common side effect of heparin? Most common, I said. The heparin side effects are they cause bruising easily or bleeding, irritation, pain, redness, allergic reaction such as hives, chills, or fever, and sometimes increase the liver enzyme. So it is good to check the liver function, right? So heparin, coumadin, warfarin, all are anticoagulant. But here, warfarin or coumadin is an orally prescribed drugs and mostly used in the outpatient setting, while heparin is an injectable medication typically used in emergency or hospital setting, right? So which one is used for in emergency quickly? Definitely heparin. So the anticoagulant action is immediate following intravenous injection and is effect for 3 to 6 hours. Within a short time they work. So if I said, what food should you avoid if you are on blood thinner? So 5 things you have to avoid if you are taking the blood thinner. Basically, the leafy green, like some very green leafy vegetables, or cranberry juice, grapes fruits, and also alcohol, not too good to take together, right? And there is some herbal medication can cause interaction with the blood thinner. Okay, so some food and other substance or herbal, they may act as a natural blood thinner and help to reduce the risks of blood clot. But without prescription, it is good not to use together. So basically the herbal medication, what would started by G, like ginger or garlic or ginkgo biloba, cinnamon, all are interact with warfarin or heparin or coumadin. It is good not to take together.